If you're caring for someone who has dementia, there are several things that you can do right at home to make eating and drinking safer. While every person is different, swallowing safety is not typically improved by just one exercise or one diet change. Instead, it's usually a combination of strategies that work together. Let's start by reviewing the 7 areas I personally review with families to optimize meal safety. And I want you to keep in mind that this video is strictly intended for educational purposes only and should not replace individualized medical advice, diagnosis, or treatment recommendations from your physician or your speech language pathologist. Okay, so now as you can see here, dysphagia, also known as swallowing difficulty, is at the center of this diagram. Surrounding it are 7 different treatment approaches that may be used to improve swallowing safety. I want you to think of these 7 approaches as tools in a toolbox. And depending on your loved one's swallow evaluation, your speech language pathologist may recommend one, several, or all of these approaches. The goal isn't to use every single tool, but rather it's to use the right tools for the right person. And this is why I say that individualized care is key. So let's start with one treatment approach: behavior modification. Behavior modification simply means changing the environment or routine surrounding a meal. Sometimes the safest and most effective intervention isn't changing the food at all, it's really changing what's happening around the meal. So, for example, is your loved one sitting upright while eating? Are they trying to eat while the television is on, causing them to be distracted and pocket food? Are multiple conversations happening at the same time, again, causing them to become distracted or confused or forgetful that they're enjoying a meal? Are they becoming tired halfway through the meal? These are all the different things that can affect swallowing safety. Simple changes like encouraging an upright position, reducing distractions, allowing extra time to finish meals, pacing between bites and sips, providing rest breaks when needed, and creating a calm, supportive mealtime environment can really make a meaningful difference for some individuals. Now let's move on to number 2, and this is diet modification. We're going to spend some time here because this is actually quite important. When it comes to diet modification, sometimes I hear a couple of misconceptions, such as thicker liquids are always safer. Not necessarily. It really depends on the situation. It depends on what's going on with the swallow. Sometimes thicker liquids are safer, sometimes they're not. The safest diet depends on the individual person's swallow ability. And this is why recommendations should always be based on a swallow evaluation. Now, to help healthcare professionals communicate clearly with one another, we use something called the IDDSI Framework. And this stands for the International Dysphagia Diet Standardization Initiative. The IDDSI Framework is a standardized system used around the world to classify different food textures and liquid consistencies. It helps us, speech language pathologists, as well as physicians, nurses, and dietitians, to all use the same terminology when making recommendations. Now, as you can see on this chart, food and liquids are organized into different levels based on their texture and consistency. The framework also includes simple testing methods that help ensure foods and liquids meet the recommended level before they're served. I'm not going to spend too much time on this chart today because it deserves a video completely on its own, but I do want to introduce it to you so that you understand where these recommendations actually come from. Now, let's make this much more practical for you. This guide provides examples of foods and beverages that commonly fall within each IDDSI level. So if your loved one has already been recommended a specific diet level, go ahead and take a picture of this screen so you have it available for future reference. If you would like a copy, a PDF copy of course, of the complete Dementia Communication and Swallowing Guide, simply send me an email to info@healthandspeech.com and I'll be more than happy to send you over a copy. Now let's move on to number 3, and this is compensatory strategies. Compensatory strategies are techniques that help make swallowing safer during a meal. Unlike exercises, these strategies don't necessarily change the swallowing muscles themselves. Instead, they help to compensate for an existing swallowing difficulty. One of the most common recommendations is taking smaller bites and smaller sips. I want you to think about carrying one grocery bag versus carrying 10 grocery bags at once. Smaller amounts are often easier for the swallowing system to manage. Some individuals may benefit from slowing their rate of eating, alternating between bites of food with sips of liquid, or performing an extra swallow before taking another bite. Depending on the results of the swallow evaluation, your speech language pathologist may recommend additional techniques that are specific to your loved one's needs. You may also notice that adaptive equipment is listed here as well. So some examples would include dysphagia cups, smaller utensils, or flow control straws. These tools don't improve the swallow itself, but they may make eating and drinking safer or easier for some individuals.
Meet Sipify, an innovative straw with a patented design that people with swallowing difficulties say helps them drink. Have you ever been told to sip small and sip slow? The Sipify does that for you.
It's common with Parkinson's to have swallowing problems. I think I can control the volume of liquid entering my mouth through the straw more readily with this than with a standard straw that I usually use. That would mean less chance that I would be aspirating liquid.
The aeration helps people with dysphagia. You pull in a tiny bit of air with each sip. The air displaces liquid, so the sip volume is smaller. The aeration also slows the liquid, so the sip velocity is slower. Its unique flat shape fits into to-go lids and most water bottles, cups, and mugs. Speech-language pathologists across the U.S. recommend Sipify to their patients with swallowing difficulties.
Okay, and lastly, it's very important to also consider the environment in which the meal is being consumed. So again, eating in a quiet room with fewer distractions, sitting upright, allowing enough time to finish meals, and providing comfortable seating can all contribute to a safer mealtime experience. All right, now let's move on to strengthening exercises. So, when most people think about swallowing therapy or dysphagia therapy, they immediately think about exercises. And I guess that's fair. Exercises can absolutely play an important role, but they're not appropriate for everyone. Swallowing exercises are selected based on the specific swallowing problem that's identified during the swallow evaluation. So, in other words, just because one exercise helped someone doesn't necessarily mean that it's the right exercise for your loved one. Depending on the findings, your speech language pathologist may recommend exercises to improve tongue strength, lip strength, jaw movement, or the muscles involved in the swallowing process itself. The goal is always to target the specific muscles that need the most support. All right, next, let's talk about more of an innovative treatment approach, and this is known as neuromuscular electrical stimulation, or hyphenated as NMES. So at some point, you might have heard your SLP talk about neuromuscular electrical stimulation. And this treatment uses small electrical impulses to stimulate muscles that are involved in swallowing. For some individuals, NMES may be incorporated into a comprehensive swallowing treatment plan. However, it's important to understand that it is one tool among many. It isn't appropriate for everyone, and it should never be viewed as a standalone treatment. All right, we're going to move on now and talk about, well, one of the most overlooked parts of swallowing safety. And that is, drumroll please, oral care. Many caregivers are actually surprised when I spend time talking about brushing teeth during a swallow evaluation or even a therapy session. You might be wondering, well, what does brushing your teeth have to do with swallowing? And actually, quite a bit. So let's talk about it. Our mouth naturally contains bacteria. And when food particles and bacteria build up inside the mouth, those bacteria can be carried into the lungs if aspiration occurs. Over time, that can increase the risk of aspiration pneumonia. Now, good oral care includes brushing the teeth, cleaning the tongue and gums, cleaning dentures if they're worn, and making sure food residue is removed from the mouth after meals. In many cases, improving oral hygiene is one of the simplest things families can actually do at home to support overall swallowing safety. All right. Finally, let's talk about monitoring and collaboration because I am a team player and I believe that teamwork makes the dream work. Now, if there's one thing that I want you to take away from today's video, it's this: swallowing safety is a team effort. As a caregiver, you're often the first person to notice changes. You may notice that meals are taking longer, your loved one is coughing more often, they're avoiding certain foods, they're losing weight, or they simply don't seem to enjoy eating the same way that they used to. Those observations are incredibly valuable because they do help us to guide future treatment decisions. I want you to remember that swallowing safety is rarely achieved through just one strategy. It's usually a combination of behavior modification, appropriate diet recommendations, compensatory strategies, strengthening exercises when appropriate, good oral care, perhaps the use of NMES, and of course, ongoing communication between caregivers and your loved one's healthcare team. If you would like a copy of the complete Dementia Communication and Swallowing Guide, please go ahead and send me an email to info@healthandspeech.com, and I'll be more than happy to go ahead and send you a copy. In part 3 of this Caregiver Guide series, we're going to shift our focus from swallowing to communication. So we'll discuss why communication changes happen in dementia and practical strategies that you can begin using right at home to improve everyday interactions with your loved one. Thank you so much for watching, and I'll see you in part 3.